All right, we're going to get started. Thank you, everyone, so much for joining us tonight. My name is Tamar Brooks. I'm a second year medical student at TouroCOM, and I'm a member of JOMA's Mental Health Committee. I'm very excited tonight to introduce tonight's speaker, Dr. Sara Babad. Dr. Babad is a licensed psychologist who specializes in working with children, adolescents, and young adults. Clinically, she treats a range of disorders with an emphasis on anxiety, OCD, and related disorders and trauma. She has specialized training in dialectical behavioral therapy and exposure-based interventions. She currently works at Northwell Health Zucker Hillside Hospital, Child and Adolescent Outpatient Psychiatry Department. Just as a reminder to everyone who's here tonight, there is a question box on your bottom of your screen that will be open throughout the talk tonight. So you can submit questions and we will try to address them all to the best of our abilities. So thank you again, Dr. Babad, for speaking with us tonight.
Thank you, Tamar. It is a pleasure to be here. I'm going to get started by sharing my screen. So the title of tonight's talk is this trauma helping your child cope with stressful life events and when to seek professional help? This talk could be hours long, but we're going to try to condense it into a reasonable amount of time. But if it seems like I'm moving quickly, it's because I am. And hopefully Q&A at the end will give folks a chance to follow up with any questions they might have. Just some quick acknowledgements and disclosures. I've been working with trauma for years, whether it's research, whether it's clinically, in different settings. And so I just want to thank some of the folks who helped me get here along the way, including the lab where I still do research, the Stride Center at Zucker Hillside Hospital, and Zucker Hillside Hospital in general, where I now work, and of course, all my previous and current patients, who I'm very grateful to for allowing me to work with them. I have no financial disclosures to make, and just as a technical point, I do work at Northwell. However, I'm not here representing Northwell. Everything I talk about today represents the relevant literature in my own clinical lens. I don't think Northwell would disagree in particular with anything I'm saying, but I'm not necessarily representing Northwell in my role here. So before we get started, I do want to point out that we'll be talking about trauma and stress, and that can be a heavy topic, whether it relates to your family, to your children, or to yourself. And so I always just like to caution people and remind folks to take care of themselves. If there are topics that come up, we won't be getting too detailed here. But if anything does come up and it's distressing, to just remember to take care of yourself, take some time, and just make sure that you're keeping an eye on that. In terms of our agenda for today, we will be going through what is trauma, brief definition of terms, and then what that might look like in terms of functionally, emotionally, cognitively, behaviorally, et cetera, in your child. We won't spend too much time on this because this could be entire hours, and it's a pretty technical debate in the field. What I really want to focus on, though, is how can you help your child cope? If you think that your child has experienced something traumatic or something really stressful, how do you take care of yourself so that you can take care of your child and talk to your child and help your child or children? And then lastly, when do you seek professional help and what kind of help are we looking for? So it's ambitious, but let's see what we can get through. So we'll start with what is trauma and why it helps to clarify. And I think that the term trauma is very often thrown around, in some ways in a good way, right? I think that this generation, we are much more attuned to what trauma might be, what it might mean. And that's a beautiful thing. And the term is used quite a bit. In addition to that, sometimes you will notice that other words are used. So things like adversity, stress. Some folks might even be familiar with the term trauma with the big T, trauma with the little t. So this is not a typo here. They're both there for a reason. And what does it all mean? So to kind of put this in context, just to give us an idea, what kind of events are we talking about? And these are events that I really just thought of off the top of my head as I was putting this together. So there might even be more. I won't read them out to you, but take a second to just look through them and notice the range of events that folks might use when they're thinking about trauma, right? So it ranges from something like physical abuse to exposure to traumatic content in the media, to natural disasters, to bullying, to parental divorce, medical trauma, and anything in between. And these are all events that folks have referred to as traumatic. And it's not just about the event itself, it's also about the context of the event. And so, for example, someone could be experiencing something like a physical assault. It could be a one-time thing, it could be a chronic thing. When they experienced it matters in terms of the age, but it could also be about developmental stage where, anyone working with kids who has kids knows this, that one 8-year-old might be at a very different developmental stage than another 8-year-old. And if they experience the same event, it doesn't mean that they're going to have the same reaction or interpret it the same way. Who the perpetrator is, if it's an event that is personal and directed towards a person, was it perpetrated by someone they know versus someone they don't? Was it personal versus collective? And I bring this up specifically because I think in the wake of October 7th, we'd be remiss not to mention when something like that can happen in the world to Jewish people, and how that might affect children. How severe is the event, right? There can be, a kid can be in a car accident and it's a fender bender, you're driving them to work, it's a small thing, it's a big headache, versus a car accident that has much more serious consequences or injuries. And there's a difference between experiencing an event directly versus witnessing the event versus hearing about it secondhand, thirdhand. And so the context of the event also matters, not just the event itself. But the question becomes, is all of it trauma? And this is where I want to clarify that not all stressful events are necessarily traumatic. So here I'm referring to the DSM-5 and the DSM-5 text revision, which is the most recent version. And the DSM-5 is the Diagnostical and Statistical Manual of Mental Disorders. It's what psychiatrists and psychologists use to diagnose mental health disorders. And it actually takes a much narrower definition of what trauma means. And what it says is that it actually requires an actual or threatened death or serious injury or sexual violence. And the reason why sexual violence is in there is because it is such a violating experience that it itself counts as traumatic. But not every event that is stressful is necessarily considered a trauma. And this is a much narrower definition. If we were to go back to that first slide that we just went through, right, and kind of pick out the events, and I'm not doing that for a reason, which is that, a motor vehicle accident, for example, could or could not involve serious injury or actual or threatened death or a fear of death. And for a child, that can be pretty powerful, right? If they thought that they were in actual danger, even if they weren't, but they really believed it. So there's variability there. So it's not necessarily even the event itself, although that's often a large part of it, but also how it was perceived. But what you can see from this is that it's actually much narrower, what we would consider a trauma versus, let's say, an adversity or a stressful life event, which are no less important, and they can certainly be impactful, but not necessarily traumatic. I'll take a brief detour while we're on the topic of the DSM to talk about PTSD or post-traumatic stress disorder, because I feel like when we're talking about trauma, that often comes up, and it's also a term that we tend to throw around, right? And I'm guilty of it too. I spend 3 hours on the phone with customer service. I get off the phone, I turn to my friend, and I have PTSD from that. And so just a brief note about it is that PTSD is actually one of many trauma and stress-related disorders that a child could be diagnosed with. It's one of the most commonly known ones, but it's not the only one. And it needs to be diagnosed by a qualified mental health professional. So we're going to spend a little time on this only because people know about it. However, you're not going to be the ones diagnosing this for your kids. Even if you are a mental health professional, I'd still say have someone else look into that for you. But there are very specific criteria someone would have to meet. Like we just talked about, there's a pretty narrow definition of what would be considered a traumatic event that would qualify for PTSD. And the child would need to be experiencing a specific kind of symptom or set, namely re-experiencing symptoms. So the idea that they think it's happening all over again. This could be flashbacks, this could be nightmares, avoidance of cues, reminders, people, events, things that remind them of the traumatic event. They might be experiencing changes in the way that they think about the world and themselves. The world is not safe. I can't trust people. And hypervigilance. That's the idea that they are on the alert. They are jumpy. They are startled easily. They are looking out for danger. These symptoms have to exist in a specific constellation for a specific amount of time and cause distress or impairment. Either the child is really struggling, or the child's like, I'm totally fine, but you're noticing they're not, or everyone else around them is. So now that we've kind of covered that, what I really want to move to then is, I think, the big takeaway from how the DSM looks at PTSD, which is that, yes, it's about the traumatic event, but it's also about the emotional response to the event. And so even though we might have a narrower definition of what trauma actually is, it's not just the event itself, it's how is someone responding to it. And you can see on the left, Webster Dictionary takes that into account in general. But when we think about trauma in a mental health lens, the American Psychological Association describes trauma as an emotional response to a terrible event. And so it's about the traumatic event, it's about the emotional response, and that's what would produce what we might call a traumatic stress response, which is how I'd be referring to it moving forward. And so for our purposes, how would we define trauma? The way that I like to think about it is that it's an emotional response to an event or events that involve perceived or actual threat to life, serious injury, or severe stressor, like a sexual assault, that overwhelms the person's capacity to cope and impacts functioning. And the reason why I like to word it like that is because what we'll go through now is what kind of symptoms, behaviors, changes in your child might you see if they've experienced something traumatic and are having an emotional response that's beyond what they can cope with. So I'm less concerned with, PTSD criteria or not, and more concerned with what symptoms are we seeing. I also like thinking of it this way because it gives us a teeny bit of leeway. Where, for example, in the work that I've done with children with intellectual and developmental disabilities, very often they'll experience events that are not going to fit the strict criteria of trauma. However, because of the way they're interpreting the world and perceiving the world around them, it is very acutely stressful for them. And they're showing all kinds of traumatic stress responses. And because of that, it's a case by case basis. But what I like to do is think a little more broadly and think of the kid in front of me and what have they experienced and are we seeing a traumatic stress response? With the idea that we know the literature shows us that the evidence-based interventions for trauma, which we'll talk about towards the end of the presentation, even if someone does not technically have a diagnosis of PTSD, they can still benefit from trauma interventions. And so that's why I like to use this definition. I'll skip through some of the numbers because I also want to have a moment to focus on resilience, which actually is the norm. And so the way we define resilience is the idea that a system can adapt in the face of disturbances. And when we apply that to humans, it means in the face of a stressor, children are able to adapt. They are able to experience what they did, integrate it. They might have a period of time where they're adjusting. However, what we know, and the research is pretty clear on this, is that for the most part, most children and adolescents are pretty resilient. They are able to bounce back. And this is particularly true in the face of stressors that are milder or do not involve direct threat to life or serious injury. What we do know is that when a stressor does involve direct threat to life or serious injury, the likelihood of a child having difficulty being resilient is much higher. However, for the most part, when it comes to stressors, your child does recover, even if it takes some time. So with that in mind, now that we have a better idea of what are we talking about when we talk about trauma, so what would a traumatic stress response look like in children and adolescents? And I think the key thing here that I like to think about is all behavior has a function. And even when we're not clear what that function is, your child is trying to tell you something. They might not even know what they're trying to tell you, but all behavior has a function. So I'll spend a very brief moment talking about physiology. And the reason why I don't spend too much time on this is because, again, this could be an entire talk in and of itself about what is happening in the body when there's a traumatic stress response. What I will say is that there is something happening in the body. There's a physiological response, right? Our brain is responding, hormones are responding, all of our organs respond. And the goal is to help us get through a tough situation. And that's not a bad thing. Right? When our body responds to stress, it's meant to help us cope with an acute situation, be able to get through it, and then our body's supposed to re-regulate. When it comes to traumatic stress, whether it's an acute event or a chronic event, we find that the body has trouble getting back to that baseline and stays in that acute state of distress, which can help explain some of what we end up seeing in terms of symptoms. So that is a very brief run through. So what might we be seeing? Well, I like to think of it, and these aren't perfectly, I think, clear distinctions because they overlap, but we could break it down into we might see differences in our child's emotional, behavioral, academic, cognitive, and interpersonal or social functioning. And we'll go through just a little bit of what that might look like more specifically. And I will say some of the things that we'll be talking about, you might notice in your child, and it's not because they're traumatized. And I'll give some examples as we go through it, because these are a broad range of symptoms. However, if you know that your child has been through something that is traumatic, or you're not sure, you're like, is it really stress? Is it trauma? But I'm seeing a lot of these symptoms, or it's a change from their usual and it's not going away, then we might say it's questionable. Is this a traumatic stress response? So we'll start with some emotional effects. What we can see in children is a low self-esteem, and this is particularly the case when it's a trauma that is direct to the child. So if it was a case of physical abuse, if it was a case of sexual abuse, it tends to impact the way the child sees themselves. We also see a learned helplessness, especially if the child felt in the moment like they didn't have any control. And in fact, that's one of the key things that we see is that kids who are traumatized, they crave control because there's this sense of helplessness maybe during the traumatic event, maybe afterwards, which can be part of the trauma experience for them. And they're trying to regain that. We also tend to see a lot of emotion dysregulation or reactivity. So what this means is that the child is really easily upset. It does not take a lot to get them upset. Once they get upset, you might see a very big reaction, which doesn't seem to fit the situation. And we might see the child having a very hard time coming back to baseline, where once they're upset, calming them down can just take so long, whether it's them calming themselves down, whether you're trying to help them, they just have a really hard time returning to baseline. And we might see withdrawal, where they tend to pull back from things that they might have otherwise enjoyed. They're quieter, they don't feel like the same kid in that respect. In terms of some of the cognitive effects, these tend to come about because the part of our brain that's responding to stress can overwhelm the part of our brain that deals with more advanced planning, organizing, all of those things we might call executive functions, which are in the frontal part of our brain. And so that includes things like problem solving, goal setting and planning, thinking flexibly. And I think, this is pretty relatable, right? If we're having, a bad day, right? So I'm already running late for work. And then I realize halfway to work, I'm low on gas. And then I have to get off the highway and I have to find a gas station. And then I'm even later. And then I make a wrong turn and I am not having it. And my capacity to cope is just completely overwhelmed. My problem solving, my planning, my flexibility, not working too great right then. And it's because I already have had it up to here. Comparing that to a day when I'm calm, I'm running on time, and I'm driving to work and notice that I'm out of gas. I'm like, oh, I remember that gas station. I can pull off at the next exit. I definitely have enough gas to get there. And I made a wrong turn. It's fine. I'll just turn around and come back. And so for a child who's experiencing traumatic stress, especially when there's already so much on their mind, right, and there's already so much they're going through, those can become really difficult for them. Similarly, working memory, the idea of how we manipulate information in the here and now. I give you, I'm on the phone, someone gives me a phone number, and I'm trying to keep those numbers in my head for a few seconds until I write them down. That's my working memory. For a child who's experienced traumatic stress, right, and they're already so internally preoccupied, right, they're having memories pop up that they don't like. They're feeling really jittery and on edge. They're looking out for danger. They're having a lot of trouble manipulating information in the moment, which makes it much harder to remember things long term. Hence, memory is affected. Global IQ is usually more affected when we're talking about trauma that happens at a very young age, that's chronic, that's severe. I won't focus on that too much, but that's not usually one that we're, very worried about. Usually IQ is fairly stable over the lifetime. In terms of interpersonal or social effects, and again, these can vary depending on the type of experience the child might have had. But what we tend to see is that a child might have difficulty understanding other people's emotions, particularly, again, if the trauma occurred at a young developmental age and was chronic and severe. They might have a negative attribution bias. And this one, I think, is a pretty common one that I've seen, where if the child has been harmed or thought they were going to be harmed, right? If they experienced an assault or any kind of abuse, what can happen is suddenly they're in school and a kid brushes past them and it's totally an accident. The kid doesn't even realize it. And this child is like, they're out to get me. They did that on purpose. They were trying to hurt me. And then they respond by shoving that kid over. And it's because they have this bias that people are going to hurt me, right? And things aren't going to go well for me. It ties into a mistrust of others and difficulty taking the perspective of other people where they might not recognize that, like, totally accidental, this kid wasn't trying to hurt me. They similarly and relatedly might be really sensitive to perceived rejection by others. And all of this might contribute to increased peer conflict. There's also this idea that I mentioned before about the struggle for control, which is to say that a child who has experienced a trauma might really struggle to regain some of the control that they feel like they've lost. And so it could look like a power struggle over the silliest things, right? Time to take out your homework. And they're like, no. Or, we're going to sleep now. Here's your pajamas. I don't want to wear those pajamas. With friends, it might show up as just being much more rigid with what they want to play and how they want to play, what they want to do. And then lastly, the idea of revictimization, which is you could imagine a child experiencing all of this in a social situation in school is a very vulnerable child. And so the kid who gets really upset when someone bangs into them by accident is then more likely to be re-victimized by other kids who are like, why are you being such a baby about that? And now we have a kid who's already sensitive, who's already prone to mistrusting, and now they are actually being hurt. Not physically, but emotionally. In terms of some of the academic effects, I won't spend too much time on this. It kind of relates to the cognitive effects, but the idea is that we might see the child having a lot more trouble focusing, which might then impact their functioning in school. And I will say that, again, there's a lot of reasons why any of these kind of symptoms might be showing up in the kid. It could be the kid's ADHD, it could be a learning disability, it could be something developmental that's completely unrelated to trauma. The idea is that if these behaviors or this kind of functioning is different for your kid, out of the norm, getting worse, and you know that there has been some kind of event or suspect some kind of traumatic event or very stressful event, that's when we might say this could be a trauma symptom. And again, these delays down here that we're talking about would again be more chronic, severe, persistent trauma that occurred at a younger developmental age or over a long span of time. And then lastly, some behavioral effects, which can often be some of the most difficult ones to manage for parents, right? Where you have a child who suddenly might be worse, might be different than usual, but they're acting very impulsively. They're suddenly not as motivated. It's like, why don't you want to do your homework? You were doing so well before. You're so good at spelling. Why don't you want to do your spelling? For older kids, we might see substance use, delinquency, right? They're skipping classes, defiance, they're talking back, risky sexual behaviors, or aggression. And these are the behaviors that can be particularly difficult to manage. As a brief aside, again, post October 7th, I thought it might be helpful to also include a slide about what we know about how children tend to respond to mass events, right? An event like October 7th that affected a lot of different people that kids have probably heard about to different extents, depending on the age and the home and the school and what's being talked about on the school bus. And just point out that a child might be experiencing loss in response to that as well. And what we know about some of these mass events, what we've learned, not exactly the same thing, but what we've learned from events like COVID, let's say, that affect a large number of people, is that children can experience a sense of loss of safety or security. And it may not be the same as some of the traumatic events we've been referencing up until now, but really any trauma does involve a sense of loss, right? A loss of that sense of, I am safe, the world is okay. Particularly if a child's concerned about anti-Semitism, particularly if they've experienced instances of that. A child might also have disrupted routines, whether that's mom is usually home Tuesday nights, but now she's going to volunteer, going to a Tehillim group. It might be something like in school, we always did things this way, but now we started doing something else. We used to be able to just hop off the bus. Now there's a security guard. There might be losses in support people in terms of who's available, right? Maybe grandma's always around, but she went on a relief mission to Israel. She's been gone for a few weeks. Now there's someone else taking them off the bus. There also might be a loss in terms of emotional support, right? Related to parental stress, because we're all human. And as much as that might affect children, as adults, we're seeing a lot of it, and hopefully more than the children are, because we want to try to shield them from things that they don't need to be seeing. And when we're stressed, it's a lot harder to be emotionally available for kids. And then, of course, the much more personal death of a loved one, some kids have been very directly affected in that respect. And that is a very real loss. And so I just want to acknowledge that that could be occurring as well. and just spend a moment thinking about, some might call October 7th a mass trauma. And again, we can go back into the debate of trauma or not trauma, but I think the important thing is like we could at least acknowledge it is stressful, it is frightening, and for some children, it might even feel traumatic. And so I just want to take a minute to go through some of the developmental differences that we might see in terms of ages. This is not a hard and fast rule. We obviously, know that each kid is different. But what we do tend to see in more preschool age children, things like regression. So if they used to be fine sleeping through the night, suddenly they're waking up a lot, they're wetting their bed, maybe they stopped sucking their thumb, but now they are. For younger kids, it's all of a sudden they want their pacifier again, they want to sleep in your room again. They might be more afraid of things that have nothing to do with what happened, right? They're suddenly terrified of the dark, or bunny rabbits or whatever it may be. They might be much clingier to parents, where suddenly every time dad leaves, like, where's he going? What's he doing? When is he coming back? They might also just seem like more hyperactive, which might be just an indication that they're more vigilant, right? They're more on the lookout. Their body is on high alert and they're just like, suddenly they have so much energy. They're jumping off the couches. What changed? And I think this one over here tends to be one that's often more disturbing for adults, which is repeated referral to events or exaggerated and dramatic stories. And this could occur again after something like October 7th or another kind of traumatic event. But this is where you might see a kid come off the bus or come home and start telling a really graphic story about, I heard that this happened. And as an adult, you're like, oh my God, what are you talking about? When actually it's pretty developmentally normal for a kid to do that because they're trying to make sense of it. And they might tell the story again and again, graphically, disturbingly, which doesn't make it any less distressing for the adults, but just to point out that it makes sense a kid that age might be doing that to try to process what they're experiencing. As we enter more school age, they could be experiencing any of these, but we also then tend to see more of the difficulty concentrating, more difficulty with vigilance, unwanted images popping up. So this is where you might have a 10-year-old kind of wander into your room like, do you think it could happen that? Or, but what about this? Because they're having some kind of image related to the traumatic event pop up into their head, and it's just hard to get rid of it. And then for older adolescents, we might see more of those disruptive, reckless behaviors, more restlessness, more irritability. We'll sometimes see more generalized fear where suddenly the kid is just more anxious overall. So it's all of a sudden like they didn't really seem to care so much about the Who test before, but now they're super anxious about it. Or vague physical complaints. So that's like my stomach's hurting, I'm nauseous, or more just low self-esteem, or difficulty trusting people. Which brings us to, so how can I help my child? So to kind of recap briefly, let's say you're like, okay, I have an idea of what a traumatic event might be. Either I'm sure or questionable, and my child is showing some of these symptoms, a lot of these symptoms. It's been going on for a bit. It's not just a week. It's not just 2 weeks. We're coming on 3 weeks, maybe 4 weeks. How can I help my child? And it's really not just about helping the child, but the whole family. And so that's why I always like to start with, you can't really help your child as effectively until you've helped yourself. And that doesn't mean that we have to pick one or the other. It's more of a yes and. And so I always recommend first checking in with yourself because parents who have a child who has experienced the trauma may experience any of the following: confusion, right? So let's say your child was in a car accident, right? Carpool, someone was driving them to school, everyone was fine, someone got a little banged up, someone went to the emergency room, and now your kid is not getting into the car. They won't go to school. And you've told them 100 times, it's fine, they're safe, it's rare, we'll drive really slowly, I'll drive you for the next few weeks. But somehow your kid is having trouble sleeping. They're just so much angrier all the time. They're getting into fights with their siblings. And you're just like, I don't know what to do with this, which can lead to a lot of worry about your child and also a sense of guilt, right? About how come I couldn't protect this, and stop this from happening. There might be, depending on what happened, someone's own sense of loss. So, for example, if there was a death in the family, and we know that grief is normative, there's nothing, pathological about that. But sometimes we can experience something called traumatic grief, which is where the child has a lot of trouble coping, whether it was a loved one they're very close to, whether it was a loved one who passed away in a really horrific way. And that might affect everyone in the family. So you might be experiencing your own sense of loss. Or, your child might have experienced something that's reminiscent of a trauma you've been through, or even if it's not exactly the same, but it brings up your own trauma reminders. And what any or all of this could manifest as at the more mild end is a sense of fatigue, your own irritability, where you're just getting so much more easily annoyed with things, feeling more cynical about things, not taking care of yourself the same way, pulling back from your social supports, or this sense of disconnection or numbing or lack of empathy, where you're like, I know what my kid is going through. Like I could kind of piece it together, I guess, but like I just don't have the energy. I think more concerning than that is when it starts impacting functioning, right? Where you yourself can't stop thinking about what happens, or having trouble sleeping, or more anxious and fearful, or your own mood is being affected. You're finding yourself avoiding reminders, whether it's something that happened to your kid, whether it's something that happened to the whole family. And so I think it's helpful to check in so that you can see for yourself, like, how am I doing? How's this going? And what do I need? And the reason why is because your response really matters. Not just because we know behaviorally that your child will copy your behavior and reactions to a large extent, but also because when we talked about the kinds of events someone might experience and how contextual factors matter, what we know is that what contributes to a child's emotional response to a traumatic event has a lot to do with the risk and protective factors at play. And going into those are beyond the scope of today's talk, but very briefly, you as a parent are one of the key protective factors in terms of the support you can offer, in terms of your ability to instill hope and make meaning, and in terms of how you respond. So, what can you do then in terms of taking care of yourself first? I would say be mindful, again, just of what's going on for you, how are you doing, and how that impacts what you talk about in front of your child. I'm a big believer that even if, kids very mature, even if they're a teenager, it is always helpful to be mindful of what you're talking about. And we'll get to this more a bit later, but what kind of exposure are the kids having, right? Especially in today's age with social media and adolescence, there's so much they can see, and it is not always helpful. I think it's true for us as adults, it is certainly true for children. So be mindful of what you're talking about, how you're talking about it, and what they're seeing, and of your own emotional reactions around your child, which I want to clarify to me, not that you should show no emotion around them. So if there's some kind of event that happened in the family and it's difficult for everyone, it is okay for you to also show emotion. In fact, that's probably a good thing. However, at your worst moment, when you really are having trouble keeping it together, that may not be the most helpful moment to model for your kid. It's okay to have emotions. It's okay to feel this way. And then to take care of yourself, to take stock, see how you're doing, reassess across all areas of your life, work, professional, social, family, personal, and then use that information to build your own support network and take care of yourself, because that's what will make it possible for you to then take care of your child. Which brings us into, how do you help your child cope? And so these are the four broad principles that I like to think of, and then we'll go into them in a little more detail. We're doing okay on time, but we might move a little bit quickly through some of this. I think first and foremost, you want to help establish a sense of relative safety and stability. And I say relative because sometimes you can establish a sense of just perfect safety. However, it is rare, right? If we think back to the example of the loss of a loved one, you cannot promise your child that no one that they love is ever going to be lost again. It's just not possible. And so you can't promise perfect safety in that respect. Similar to a car accident, similar to anti-Semitism, you can't promise that, but you can convey a sense of relative safety and stability. And we'll discuss a little bit more about what that might look like. It's also important to maintain that empathy and warmth, which I think part of it comes from just the understanding. Like, attending a talk like this, some of this information might be new to you, some of it might not, but really trying to keep that in mind as you're trying to cope with difficult behaviors. And taking care of yourself is part of that, because it's hard to maintain empathy if you don't have empathy for yourself first. It's also about using the principles of reinforcement effectively. And so, like I pointed out earlier, there's likely to be a lot of behavioral responses that might be very distressing for you as the parent, and that is totally normal. And then the question is, how do we use all the good principles that we know are effective in managing behavior as best as we can? And then lastly, it's about creating open spaces to talk about what's happening. And sometimes, let's say with October 7th, right? Your kid really might have questions. And if they're getting information from kids at school and on the bus or even at school, you might want to be the person to really talk to them about it and help correct misinformation and convey a sense of hope and safety and stability for them. If it's something that was, more personal to the child or more specific, it is still helpful to create spaces to talk. Just how we do so might be a little bit different, and hopefully we'll have some time to get into some of that. But firstly, I want to talk about consistency and predictability, which is one of, I think, the first ways that we try to establish a sense of relative safety. And the idea is that when a child has experienced something traumatic, highly stressful, their sense of order has been upended, right? Their sense of control has been upended. And very often, for one reason or another, routines get upended, right? Especially if it's something that affects the whole family. Suddenly, this person's not available the same way anymore, or that person's just not around anymore, whether it's emotionally, whether it's physically. And so, what we do try to do is we advocate for maintaining whatever routines you can, whether that's, look, after school is a whole different story, but in the morning, we follow the same routine. Or on weekends, we still do the same routines. It's about maintaining consistency whenever possible. And when there are changes, because there will be, we're not saying we can control every aspect of a kid's environment, is to warn the child about changes, to let them know ahead of time. And sometimes some kids are just wired that way that they always just need to know that. But for a kid who's experienced a traumatic event, they may not have always been like that. And what we know is that after they've experienced something traumatic, it is helpful to warn them of changes because, similar to the example I gave with driving and needing to get gas, right? It's hard to think flexibly when you're already in that escalated state. And so getting a heads up is really helpful. Also, the idea of giving choices, which goes back to the child's sense of lack of control and lack of having had choices. And really, it could be something as simple as a forced choice of like, do you want to wear these pajamas or those pajamas? Do you want this for dinner or that for dinner? Should we do math homework or spelling homework first? And then anticipating difficult moments. If you know there's a tough moment for your kid, the first few times it might not be like something you can anticipate, but after enough time, if you know it's going to be tough, it can help to anticipate it. Not because, again, we can control everything, but because that can help make things a little bit easier and increase the sense of consistency, predictability. The other way that you can help set up a sense of relative safety and stability is with verbal support and reassurance. And I like to think of support and reassurance as two separate things. And I borrow the concept of support from a really wonderful researcher and clinician, Dr. Ellie Leibowitz at Yale Child Study Center, where when we think of support, what I like to think of as a combination of two things, validation and confidence. Down here. Validation is conveying the idea to your child that what they are feeling is okay and that it makes sense in this moment. And I always want to clarify validation does not mean that you agree with what is leading to the emotion or what they're doing afterwards, right? So you may not understand why what just happened is eliciting such a big emotion. And you may not agree with how the child is responding, whether that's yelling or messing with their siblings or fighting with you. But we could accept the child is angry, right? That is something that we can validate. The child is angry, hurt, scared. And validation is about conveying, I see that. I don't have to agree with everything around it, but I can see that. I hear it. I know that you're upset. I can see that you're angry. I'm guessing that you're scared. And the nice part is that kids will tell you if you're wrong. If you're like, I can see you're angry, and the kid's like, I'm not angry. All right, so what is it? I'm upset. Great. We can validate, I see you're upset. And confidence is all about expressing to the child that this emotion cannot hurt them. That it's not that it feels good to be that upset or scared. It's not that you can promise it's going to go away or going to do whatever they're asking. It's that they can survive that feeling. You can help them. Maybe the feeling will go away, but either way, they can survive it. That's the confidence you're conveying, that they can handle this. And so it might sound something like, I know you're scared right now, and I am sure you're going to be okay. And what's nice about it is that you're not demanding anything of the kid. You're just telling them, like, I really believe in your capacity to cope. Reassurance, different than support, is the idea that you are going to try to help your kid, right? You're reassuring them, it's okay, I'm here for you. We're going to protect you, not going to let someone do that to you again. And that's the idea over here of, we love you, we're going to help you through this. And both support and reassurance can be helpful. And with a child who's been through something traumatic, you might find yourself giving actually quite a lot of reassurance, and that's okay. What I do like to point out is that if you find yourself giving constant reassurance, so it's not just a few times, it's all the time, your kid's following you from room to room. But is it going to be okay? Is that going to happen again? But what if this happens? But can you just come with me and do this, right? If it becomes to that level where you're like, I am constantly giving reassurance, this is a bit of a preview for the next part of the presentation, but that might be an indication that it's helpful to get extra support. In terms of responding to problematic behaviors, this is where I think empathy and warmth come in, and the usual behavioral principles that we know are effective. It is hard to respond effectively to problematic behaviors when you are already so frustrated with your kid that you just can't take it anymore. Also, the same behavioral principles that we know are effective will be helpful for a child who's experienced something traumatic, so long as we're maintaining that empathy and understanding where it's coming from and being able to validate and reassure. The key thing here that I want to point out is to look for the good behavior. So, for example, right, your kid is afraid to get into bed. I don't want to. There's a monster under the bed. I can't do it. You have to come with me. I need you to stay with me. And you get the kid into the room and you're like, all right, I am going to go put this away in your dresser. I want you to get into bed while I'm doing that. But did you check under the bed for monsters? Yes, I did. Okay, kid gets into bed. That is your opportunity to look for good behavior and praise. And that's when you might say, like, I'm so proud of you for getting into bed just like that. That was amazing. You did it so quickly. Sometimes we miss those moments when you're like, oh, thank God they're in bed. And then, like, okay, let me tuck you in. And then what you might find is you tuck the kid in, you start leaving the room, and they follow you out. But if you can catch your kid doing that good behavior, they got into bed and praise it, you are more likely to see them stay there and do it again the next night. It's not always magic. It sometimes takes repeated efforts because we're shaping the behavior. But the idea is that if you want to see the behavior change, you want to look for the good behavior and praise it in a specific, labeled, and immediate way as possible. Part and parcel of that is also actively ignoring whenever possible. And I'll move through this quickly in the interest of time, but the idea is that you want to ignore what is annoying and irritating is my general principle. So for example, you're sitting at the table, your kid's been through something traumatic, you notice they're just a lot jumpier, they're sitting at the table and they are tapping, tap, 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 tapping. Now, if there are other kids involved, they might get annoyed by it and it's hard for them to ignore, and that's a whole other story. But for you, it's driving you crazy, the tapping, and you really just want to say something. If you can muster all of your own emotional energy, take a break, distract yourself, do something different, do some mindfulness, and not comment on it, annoying and irritating behavior does tend to disappear when we can ignore it. However, I do not advocate ignoring dangerous and destructive behavior. So that can include a child hurting someone, it can include them breaking property. Sometimes it can include really demeaning or vulgar language. And I think with that, it really comes down to the family in terms of vulgar language and what they're comfortable with. But when it's dangerous and destructive, we do establish safety and you do respond, which brings us to punishment, where sometimes you might need to do something aversive to get your kid to stop doing something. That's how we would describe punishment. And the idea is that punishment works most effectively when it is used sparingly, even for a kid who is really struggling behaviorally. Because if you lay it on too thick too quickly, you run out of options. And I can't, even describe how many children I've worked with who, whatever it is they did, their phone was taken away for 2 weeks. And by day number 2, they're like, I've got nothing to lose. I found a way to text people from my laptop. And once the kid has nothing to lose, you lose a lot of the leverage that you have. So I say that punishment is most effective when it's used sparingly, in a time limited and specific way, and intentionally. So if your kid does something, you're like, that's it, I've had it up here, I'm taking your phone, we're done. If it's not intentional, you're much less likely to be using it effectively. And then lastly, I want to talk about just how to talk to your kids about traumatic or stressful events. I'm actually going to skip this slide in the interest of time and kind of move on to the general idea, which is talking to your kid about these kind of things can be really tough, right? It doesn't, come with a rule book necessarily of what to do. And so these are some of the general principles that I like to recommend. I'll move through them pretty quickly, but the idea is that there are effective things to do in terms of setting the stage, starting the conversation, continuing the conversation, and being able to have it be a supportive space. And then some very clear, like, do not do these things. So in terms of setting the stage, I think, again, we always go back to make sure that you have sufficiently processed what you're about to talk about. If your child has experienced an assault and you yourself need a minute to really be able to have that conversation with your kid where you can be there for them and make sure it's about them, do that first. It's not helping your kid necessarily to have that conversation where you're having trouble keeping it together for very understandable reasons. But now it's harder to be able to help your kid be able to talk about it if they want to and if they're ready to. Secondly, expect questions. And for example, this is particularly relevant when it comes to something, let's say, like October 7th, like let's say, if let's say someone in the family is sick. And this is the idea that you can expect there are certain questions your kid might ask you. And if you know they're going to ask or suspect they might ask, have some answers prepared. You don't have to have all the answers. It is okay to say, I don't know. However, what you can answer, it is nice to be able to have that prepared. And I think the second part of that that's super important is thinking about what you want to say, because there are answers, and sometimes the kid doesn't need the full answer, and they don't need all the details. And that depends on the kid's age, it depends on their developmental stage. You know your child best. The golden rule I like to follow is you provide enough information to answer questions, but not so much that you're fueling a sense of anxiety. And again, this can be really case by case basis. And then, of course, to find a quiet moment. Find a moment alone with your child or children where things aren't hectic, where you have the time and space emotionally, physically, mentally to have that conversation. In terms of actually having a conversation with your kid, I always like to think start by discussing the facts. And again, this can vary based on the context. If it comes to something like October 7th or an event that there are facts to discuss, like let's say a relative was in a car accident, the kid's been hearing things about it, but they don't actually know what happened. And you're noticing that they're just not acting like themselves. And you're like, all right, we got to tell them enough to help them feel safe. I'm going to sit down and have a conversation with them. Tell them the facts that you feel are appropriate. It doesn't have to be gory. It doesn't have to be too specific. Again, you know your child best, but tell them enough so that they have an idea and don't have to guess. When it comes to something more personal, like let's say the death of a loved one, thinking of an instance where parents called me and asked me for their preschool age child. A family member was sick. They were going to pass away very imminently. This kid was very close with them and kept asking, where are they? Where is Saba? When is Saba coming back? And the parents didn't know how to respond. They said, how are we going to tell them when they pass away? And so my recommendation was to tell them the facts, right? Let them know that their grandfather has died. And then, of course, there were a few more things that we talked about. But what ended up happening was the parents actually didn't do that and told the kid, Saba has passed on. Hashem wanted him close. He's in a better place, which I usually wouldn't advocate, even for a young kid, because we all sing Hashem is here, Hashem is there. And for a young kid, that could be terrifying, right? Hashem wanted him close. What does that mean? Does he want me close? And lo and behold, a few days later, the parents were like, yeah, the kid took it so well. She was like, oh, okay, no problem, moved on. And then a few days after that, her 10-year-old brother said, well, yeah, because Saba died. And this kid turns around and says, Saba's dead? What? And it turns out the whole time the kid never realized that he had passed away. And then the parents had a whole conversation. The kid had all kinds of questions. This was the first time she was realizing that he was not here anymore. And she starts asking, well, where'd he go? And what happens to his body? What happens to his neshama? And that's when you can have a productive conversation. And so that's why I always say start by discussing the facts, again, in a developmentally appropriate way for your child. It always also helps to find out what the child already knows and then use the opportunity to correct misinformation. Because a child might assume things, they might have heard things, who knows what their friends have told them. This is at any age and stage. And this is a wonderful opportunity for you to be able to be the one who shares information with them that's accurate. I'll move through this one a little bit quickly, but just the idea that it's okay to say, I don't know. It is absolutely essential to reassure. And particularly, I like to think that it helps to include your child in efforts to establish a sense of relative safety. So for example, if we're talking about a car accident, it is helpful to let your kid know, like, what can you do to stay safe, right? Cars are usually safe. Sometimes they're not. You can wear your seatbelt. And that's something that you can do to stay safe and help your child feel included in what they're doing and what you're doing to help establish a sense of safety. I'll skip through here and just skip to the what not to do. And just cautioning, avoid discussing gory or graphic details. Your child may bring it up, and that can be very distressing for you, but you don't need to. And I say, share the facts and answer questions. It doesn't have to be gory or graphic to be able to reassure the child. In fact, just the opposite. I also want to just emphasize again, do filter news coverage. It is not helpful even for older children. It is not helpful for us to have access to the amount of information that we do. It is also helpful to avoid blame or shame. And this is certainly of the child, right? Where you want to avoid any kind of that. It can also mean avoiding blaming or shaming other people involved. For example, if the child experienced a traumatic event at the hands of someone that they were close with, if the child comes in and says, like, I hate this person, you can validate that. But if the child isn't saying that, you may not want to be the one assigning blame and shame because it's complicated for the kid, and that can make it more confusing for them. You also do not want to try to force your child to talk if they don't want to. The idea is to create space and let them know you're there for them. And the strategies we just discussed are helpful in doing that. But if your child's like, I don't want to talk about it, that's fine. Because importantly, you are not on a forensic fact finding mission. The idea is not to get details of what happened and find out exactly how it went down. The idea is to give your child a space to talk about things for you to validate, reassure, correct misinformation. You don't need all the facts for that. Which brings us to, so then when would we ask for more help? When is it a case where you're like, this is too much for me? And so there's a lot of different ways to know, but this is kind of summarizing what we just went through. If you're noticing significant behavioral concerns, if you're trying to maintain consistency and routines with your child, like we discussed, and it's really not working, either you're like, I cannot handle the intensity of how much my child is pushing back. Despite my best efforts, I'm usually really good at this. My kid's just not responding, or I just need some help setting up these routines. Like I mentioned, the excessive requests for reassurance beyond just more than usual, but I mean like it's excessive, it's repeated, it's constant. Having trouble seeing the good, and by this I mean you're looking for the good behavior, but you're seeing so little of it that you don't even know what to reinforce or praise anymore. You're just like, I have so few opportunities to do that. If your child is unable to talk about what they're going through and you are seeing so many of the traumatic stress symptoms that we talked about, and you're like, I know they're going through something. I've created the space. They don't want to talk about it. I'm not going to force them to, but like something's wrong. Which ties into if your child's symptoms are just beyond your capacity to cope, they're not coping, you've tried strategies and it's not working, and the child is just not themselves, that might be a good opportunity to seek more help, particularly if this has been going on 1 week, 2 weeks. By the time we get to 3, 4, 5 weeks, I would say it pays to get help. And what that means, and I want to just, we could go into great detail about how to find a provider. I know how challenging that can be in today's day and age, which is unfortunate. What I do want to say is that when you're looking for someone, if you think your child has experienced a traumatic event, if you're looking to treat the trauma, you want to be mindful that you're looking for someone who is providing trauma treatment, not just trauma-informed care. Trauma-informed care means that the provider understands how trauma can affect functioning, and that is amazing. We want all providers to be able to do that. However, if you're looking to treat the trauma itself, you're looking for someone who can do trauma treatment, which is usually a step beyond trauma-informed care. I can treat anxiety in a child with a trauma history with a trauma-informed approach, but I'm not doing trauma treatment per se. Very briefly, there are ways to know that you are getting your child the best possible treatment. And as a disclaimer, I practice what we call evidence-based interventions or evidence-based treatments, which means that these are treatments that have been rigorously tested, that show improvement, that are known to help children who have experienced traumatic events, but there's evidence-based treatments for a range of disorders. If you'd like to find out more about this, the California Evidence-Based Clearinghouse is a great place that has just all the trauma treatments and really any other kind of treatment you're looking for. There's some other great resources, which I'm happy to share afterwards if people need. But the idea is that if you're looking for evidence-based interventions for your child, there are some really good ones that we know work. The top 3 have the best research to support them. EMDR is a popular one folks have heard of, prolonged exposure for adolescents, and trauma-focused CBT. I happen to be very well versed in trauma-focused CBT, and the research does seem to show even relative to prolonged exposure in EMDR, it's probably the most effective one. However, there are other ones, and any of those are great. Child-parent psychotherapy is excellent for little folks, particularly if as a parent you also have a trauma history and you're having a lot of trouble helping your child cope with theirs. Alternatives for families is a treatment that's based off of trauma-focused CBT, but is actually meant for if one of the people perpetrating the trauma is a parent. So if there's physical abuse and one of the parents is the one perpetrating it, Alternatives for Families is an excellent way to help reintegrate and repair the family relationship and help treat the trauma in the child. And then these last two over here have an asterisk because they are excellent evidence-based interventions that are more recently being applied to trauma in children. However, we know they work really well in general. There's emerging evidence to show they can help treat trauma. And so if you were to find a provider who said, I'm doing cognitive processing therapy for a 16-year-old, I would say go for it. That is a whirlwind tour of evidence-based treatments. In general, there are some common components that all of these treatments might contain to various degrees, but the idea is it's going to teach your child how to manage stress and trauma reminders, teach them relaxation skills, teach them how to face the reminders and fears related to the trauma. There's often a narrative component to help them process the trauma. For older kids, there's usually reframing of those unhelpful beliefs like the world isn't a safe place, I can't trust anyone. And very often, it works on enhancing the parent-child relationship, and parents are a huge part of treatments. With that, I will wrap up because I want to leave some time. I can stay on for a bit longer if folks have questions. But I want to wrap up to leave time for that. So I will stop here and turn the mic over to our moderators.
Thank you so much, Dr. Babad, for that excellent talk. I think we have time for just one or two questions. So here's the first one for you. Can you speak a little bit to the development of anxiety from a scary experience and how that differs from a trauma response? So one of the participants asked about a child who was reprimanded in school and now is having symptoms at school because of that.
Sure. So the way I like to think about it is that when we're thinking of anxiety versus traumatic stress, anxiety tends to be anticipatory. So for example, I'm thinking of a kid that I worked with who had a very challenging experience at school. School was not supportive of them and whatever difficulties they were going through, not trauma related. And they really hated going to school, had a lot of anxiety about it. They would anticipate what might go wrong. Oh, what if the teacher yells at me? They're not going to be able to help me if I'm upset. I'm going to fidget and they're just going to get so angry at me. It was a lot of anticipation for the future. I like to think of traumatic stress as more towards the past. So that's a child who's thinking more about what they've been through in the past, right? The world isn't safe. I'm going to get hurt and bullied like I was bullied beforehand, right? I'm going to get beat up in that hallway. And they're walking through the hallway. They're not worrying about, the what if next time. This is where it happened. This is where I was beat up. And so I like to think of anxiety as more of that future-focused anticipation. Versus traumatic stress, which is more thinking backwards towards the past and what happened.
Great, thank you so much. So I guess we'll hold it here. If anyone has remaining questions, we'll be on here for a couple more minutes if you want to post an anonymous question in the Q&A box. Otherwise, thank you again so much, Dr. Babad, for speaking with us tonight. And this talk was recorded, so it'll be uploaded to the JOMA YouTube page in a few weeks. So definitely look out for it and feel free to share it with anyone who you think will benefit. Thank you everyone so much for joining us tonight.